Good afternoon to everyone that's here today. I'm going to start with a quick intro of the team that's here and myself as well. I'm Jyoti Sood. I'm a GP in Redbridge. I'm proud to say that's actually the birthplace of SPIN and Fellowship Programme. I'm also the North East London clinical lead here supporting this programme. I'm joined by my lovely colleagues here. Sarah, who's going to be chairing the meeting today. Sarah, do you want to say something? Introduce yourself quickly, please.
Good afternoon. I'm Sarah Buthley. I'm the North East London project manager.
And of course, our lovely Charlotte.
Hello, my name's Charlotte Cooley. I run the fellowship scheme for North East London and across North London as well.
Thank you, Charlotte. And Siddharth, we can't forget you for all the hard work that you've done around organising this day. So just a quick intro, please.
Hi, thank you, Jyoti. I'm Siddharth Chilika. I'm part of the program management office for this program.
Thank you very much, Siddharth. So you would see the agenda on the page here now, and hopefully as the presenters come, they will be able to introduce themselves as well. Now, for me, there's never been a better time to choose general practice as a career. Even previously it was the career for me, but now I feel it's the best career to have. I say this because there is smarter collaboration, flexible way of working, and of course, the big thing, digitalization. That will be covering cross-sector, allowing new opportunities for the GP and the GP nurses, if I may add as well, for this fellowship and spring program. As you would be aware, this is a joint venture between HE and NHS England to recruit and keep in post. So this is all about the retention and recruitment of newly qualified GPs into programs. We heard from the newly qualified GPs that they preferred portfolio careers when we did start to set up about thinking and setting up the new program, the SPIN program. So this will allow people to develop portfolio roles. And this is a really unique opportunity because this will then allow you to pick up roles to align yourselves with a new way of working and where general practice is heading to us, that multi-professional MDT kind of sort of model, the fuller model that we are all heading towards. But it will also allow you to keep your hands in the day-to-day general practice, but then develop the other role. With that, you also have the CPD offers that again allows you to develop your CPD activities and roles further. Now, we were really, really pleased that we've actually had really good results across North East London, which you're going to hear, and Rachel Roberts, who's our excellent champion for this program, is not here with us just yet. We'll talk about the benefits and the numbers, but also we'll hear from the fellows about the success stories and other opportunities. So all the fellows that are here, I would really urge you to please ask any questions, points of clarification here and now. And of course, you've got all our details. If you want further information, just do contact us. And with that, I'm going to pass this on to Sarah and Charlotte to talk through the overview and then take Q&As. Thank you very much, both.
Thank you, Jyoti. Good afternoon, everyone. Just to recap for those who've just joined, I'm Sarah Buthley and I'm the SPIN project manager for North East London. I'm joined by colleagues in the team today. Dr. Munir Alizabeh is running a little bit late, but he'll be online shortly. Charlotte Cooley, my colleague, who's the North East London Programme Director for the nurses side of the fellowships. Myself, Siddharth, Johanna Shule, and of course our local training hub managers are here today. It's a joint effort in terms of running the scheme. We're all involved in the various facets, as you can see listed below, which includes events like this to bring everybody together, the registration of new fellows onto the scheme itself, contract management, financial arrangements, running the peer support sessions, and dealing generally with all the questions and answers that people undoubtedly have throughout the fellowship programme, as well as liaison with other stakeholders, including, of course, HE and NHSEI, who supply the funding. We also liaise with all of the kind hosts that we couldn't do this without, so they will provide the SPIN portfolio opportunities. We're in contact with them throughout the year to ensure that your fellowships run smoothly. Thank you, Siddharth. Johanna, could you possibly put the next slide. So what I want to do now is just go through some of the programme facts and the eligibility criteria, in particular for GPs. My colleague Charlotte will be joining midway through to discuss the opportunities for GPNs, but at this stage I'm just going to cover the GP aspect of the programme. So the SPIN fellowships, as Jyoti just referenced, are a 1 or 2 year programme of support for newly qualified GPs. That's those that have qualified in the previous 12 months. We do, of course, consider consider extenuating circumstances. So if a fellow joins us and perhaps they've been on maternity or paternity leave or have had other issues in their personal life that have perhaps enabled them to care for fellow family members, then obviously we will consider those individuals. But the key criteria are that they are newly qualified within the last 12 months. And as Jyoti just said, the scheme is aimed at improving recruitment and retention of GPs into substantive posts, so that we can obviously enrich the skills and availability of GPs in North East London. The idea is that you take up a substantive contract in a GP practice, and then you can pursue an area of interest and development for the 2 years of the fellowship, and you will be released for either 1 or 2 paid sessions per week to pursue that area of interest. And other benefits such as having funded mentorship, CPD grant and peer support sessions, which are run on a monthly basis, are all part of the package. We do obviously take inquiries from GPs who are about to qualify. So we are in touch with a number of individuals at the moment who are due to CCT this summer. Obviously, we're registering their interest and getting them onboarded, ready to start their fellowships, hopefully in the autumn time. We will be talking about the different types of fellowship schemes, but one of them is a PG Cert option, which is listed there, where the criteria is slightly different in that a GP applicant can apply up to 5 years post-qualification, as long as they have undertaken sufficient clinical work and are able to maintain their registration on the performer list prior to application. But again, they must hold a substantive permanent contract and need to be working ideally 4 sessions per week. That goes across all of the SPIN fellowship scheme. A minimum of 4 sessions needs to be the key criteria here. So I'm just going to run through the 3 main fellowship options. The first one is the traditional SPIN model, where a fellow is employed in a substantive practice, working between 1 and 7 sessions per week as a GP, and then they will elect to do a fellowship in addition to that. So an extra 2 sessions a week following an area of speciality that they're particularly keen to pursue. There are a variety of options that we have available, and we can discuss those with you on an individual basis. The Training Hub are also excellent at advising on local fellowship opportunities and giving guidance on the scheme overall. And just to state at this stage that the funding that is provided is not given directly to the fellows, it's transferred via the practice. So in every instance, the practice acts as a conduit for the funding supply, and the funding would go directly to the practice and then be transferred to the fellow according to what sessions they were actually being reimbursed for. So for example, if you were doing full-time 9 clinical sessions in your practice, then you'd be released from your contract to pursue the fellowship, and you would therefore the practice would retain the funding and release you. If you're working less than full-time and you're doing your fellowship in addition to your contract, then the funding would be transferred to you via your practice. The second option that we have is the PG Cert Healthcare Practice offer. There are a limited number of spaces allocated to each London area. In North East London, we've been allocated 7 spaces this year. And again, as previously mentioned, it's based on eligibility first off, which is having qualified in the last 5 years, and then on a first come, first served basis. It is a very popular offer, and we are collating interest from a range of individuals at the moment, with a closing date of the 28th of July. In this instance, the funding bursary of just under £19,000 is transferred directly to the fellow. It's provided in 2 different tranches per year, and individuals are requested to keep Tuesdays free for this particular course, with study, and I think they do some practical work as well. The third option is more of a build your own fellowship, whereby an individual may not be wanting to pursue some of the portfolio offers that we have already listed on our website. They may, for example, wish to do a diploma in a particular area. In this instance, that's absolutely fine, and fellows are eligible to receive the equivalent of 1 sessional payment that they would have in their practice. So they'll get that from the national pot. So for example, if you're a newly qualified earning £10,000 per session in your practice, then that would be the amount of money that you'd be given to pursue this particular fellowship offer. So this would be the equivalent of 1 session per week. Again, the practice would receive the funding, which they would then transfer to you. And for this option and for option 1, where a fellow may be doing 2 sessions, it's important to note that the practice would also receive 30% in addition to the funding to cover their costs, including national insurance, tax and pension contributions. So just to recap on some of the programme benefits, which Jyoti touched on in her introduction, the fellow, in addition to the funding, gets CPD time and up to £2,000 in a grant per year, depending on the London borough that they are based in. Access to training hub learning and development forums. We're obviously on hand to help with any queries that you have as well. It's a great career development opportunity. You have the opportunity to have mentoring on a monthly basis. You're also required to attend mandatory peer support sessions on a monthly basis where you will be reimbursed for your time. And of course, it's a great opportunity to widen your network and build your confidence in the primary care system. So we have touched on this a bit already, but the reimbursement is such that the funding doesn't go directly to the fellows, except in the case of the PG cert. As I said before, the practice acts as the conduits. The money will come via NHSE and will be transferred to the practice, who will then either retain the funding to cover the reimbursement of the fellow if they are working full-time in the practice, or will be transferred directly to the fellow to reimburse them for their time. And this infographic hopefully gives a clearer picture of the funding reimbursement, but I think I have covered it already. So if a fellow is working full-time, for example, doing 9 sessions a week in their practice, and they wish to pursue a fellowship opportunity, then the practice in effect would release them from their contract to enable them to pursue the fellowship and would retain the funds that they are given from NHSEI. However, if an individual is doing, say, 5 sessions a week and then chooses to pursue the fellowship in their own time, so doing, say, session 6 and 7, then the practice would transfer the funding direct to the fellow to compensate them. On this infographic, you can see an overview of what we've been doing so far for the 23-24 cohort. So we'd actually ran this event this time last year. This tends to generate quite a lot of interest, obviously, for those who are going to be qualifying in the coming months. And that's when the momentum really starts to gather. So we've got organisations from across NEL who are supporting various portfolio opportunities for our fellows at the current time, but ours is a rolling programme. So throughout the course of the year, we are in discussions with various organisations to try and bolster our fellowship offering. And obviously they are influenced as well by what the fellows themselves wish to do. We've got 44 practices who've applied to recruit a GP or GPN across NEL, and we list all of our vacancies on our website, and we can send you a direct link to that if you are interested. Currently, we have 67 GP fellows and 10 GPN fellows who are actively engaged in the programme, and we're in discussions with approximately 20 people at the moment who have registered and will be qualifying later this summer and then pursuing their fellowships. And there's a breakdown there given across the different London areas that we cover. And we've also provided a little brief summary there of the different areas that fellows are choosing to pursue. And again, further details on those individual fellowships are available on our website. And as I mentioned before, you are required to attend a monthly peer support session, which commenced as part of the fellowship in 2021. And they are run by, for the nurses, Charlotte Cooley, and for the GPs, Dr. Munir Ali Zubair, who will be joining us shortly. We will be hearing from some of our current fellows a little later in the agenda today, but I've just put there some comments from some of our current fellows. I think generally speaking, people find the peer support sessions very useful. It's a good opportunity to engage with others that are doing the same sort of work as yourselves. The mentorship programme has also been very well received. Again, that's optional, but people have found that to be very rewarding. And I think generally people find the peer support is a good platform to share concerns and discuss things that have happened in the previous month, and just to feel more connected and engaged with the whole system. I'm just going to hand over now to my colleague Charlotte, who will give you some more information on the GPN side of things. Thank you, Charlotte.
Thank you. Okay, so again, the SPIN fellowship is open to all nurses that are new to general practice within the last 12 months. So that's anybody. They don't have to be newly qualified. It's not just those coming in through the academic or foundation routes. It can be people who've transferred from secondary care. It can be advanced nurse practitioners. The key thing for the nurses is that they are new to general practice within the last 12 months. One of our key enablers really for this is knowing when people join primary care for the nurses. They come in at different times through the year. So if you do know of anybody that would be interested or is new to your practice or within your PCN, please do let me know and I can follow up with the opportunities directly. Next slide, please. Again, this kind of gives the a nice view of how the SPIN offer, particularly for the nurses, it's a wraparound support service, and it gives the general practice nurse an opportunity to develop themselves within primary care. Having worked in primary care for a long time, you know, the transition into understanding the systems and the way things work, I think for anybody who comes into this area, what this does is it enables the nurse to really have protected time and learning, developing their networks. And this can be, again, for 1 to 2 years. The CPD offer is generous for nurses, and it's something that can be discussed with their practice or PCN or nurse leads to really fit in around their particular area of development. Next slide. Thank you. I know there's a lot of benefits. I mean, I think this slide obviously has different areas for the fellow themselves, the PCN, the portfolio hosts, and then overall. Some of the feedback that we've had from our practice nurses are that they have good support, pastoral care, there's networking involved. They can determine through the action learning set process what the learning that needs to be done. They can support each other, and they're beginning to actually offer through their fellowship some time in terms of mentorship and supervision of each other within the different groups. Next slide. Thank you. This is just to give people an idea, really. I think with the nurses, the kind of expectation, you know, of how much time are they away from practice. The peer support, we do try and incorporate as many things as possible that we know that any nurse who's new to primary care will need in their first 2 years of practice. So not only is there peer support, there's also clinical teaching, action learning set, mentorship. I offer one-to-one coaching. We incorporate the preceptorship, clinical supervision, and triple SA training. It really is a very, very full timetable for the practice nurses. What this obviously demonstrates is that we have a North East London group that's pan-London and meets on teams, but we're very, very clear that actually we do have borough-based schemes that we will also wrap around. So in Tower Hamlets, City and Hackney, different schemes are running, and the fellowship actually incorporates that and aligns with those. So we're not competing with different offers across the system. We're also very conscious that the academic and foundation courses may be a lot for the nurses. So again, it's one of a supportive process rather than something that's going to overwhelm the nurses. Next slide, please. So this is just a quick area in terms of if anybody is interested through GPs or general practice nurses, we have links to the onboarding questionnaires. But I think, again, a key thing would be is knowing where new people are in the system for us, for the nurses. We follow up on anybody, any leads that we're given. And usually once the nurses are on the fellowship scheme, they start to begin to see the possibilities of what they can achieve within the 2 years. We are trying to align all of the different things that are available. So then the retention of people beyond a year of their initial general practice nurse training, we're achieving that through the fellowship scheme. Next slide, please. And that's just a link to our website, just with all of the information that is on here. And of course, you can come to any of us and we can meet with you if necessary. Okay, I'll hand back over to Sarah now.
Thank you, Charlotte.
Thank you.
Thank you. So that's it in terms of the overview and introduction to the SPIN Fellowship Programme. Our next agenda item isn't for another sort of 10 minutes or so. So if anybody has any questions, please feel free to raise them. I can't see everybody in the participant list, I'm afraid. I think, Johanna, you've got a question?
Hi. Yes, my question is, so for the GPs that are qualified in the previous 12 months, so does that mean that we can at any point sort of enter the program? So let's say in 11 months, I CCT this summer. So let's say in 11 months, I want to join the program. Would that be okay to then do that for 1 year?
Yes.
At that point? Okay,
yes,
perfect.
You can still join for 2 years, sorry, but as long as you're within the 12-month qualifying period, you can commence, say, in the 11th month and then still do the 2 years.
Okay, amazing. Okay, thank you.
And Nora has her hand up.
Okay, sorry, thank you. Nora?
Hi. Thanks very much for that, girls. That was really, really useful. One thing I wasn't aware of, I'm ashamed to say, was that it also included ACPs. So that's really great to know that. Can I assume that that is the same substantive post? It wouldn't count for
Part-time.
locums,
Yeah, no,
or that?
There is a reference to locum. So if there's substantive locum posts within the operation guides, there's very few nurses in particular that we don't realise that they're offering primary and medical services usually in a full-time capacity. But it's open to we can review each application and have a look at how it fits around that work and what's on offer.
So basically the message is, if anyone new and anyone interested, get them to have a chat. That's
Absolutely,
lovely.
yeah. Thanks.
That's lovely. Thanks, Charlotte.
And Emma Spence.
Okay.
Oh, hi. I was just wondering, when are the mandatory peer support sessions for GP?
They are the third Wednesday of the month. Munir's just nodding there. Yeah, third Wednesday of the month at 2:00 in the afternoon.
And so for me, I'm a GP, but I also work in a urgent treatment centre on a Wednesday. So I wouldn't actually be able to come to them because I'm working not in GP that day. How would that work? Does that mean I just can't do this programme?
No. Munir, do you want to take that question, please?
Yeah, sure. Okay, so as the number of fellows in the scheme continues to grow, we're looking at increasing the number of sessions that are available to create that flexibility for those who maybe, despite your best efforts, if you're unable to come. Most of the time, what we do is whenever we have discussions about what your SPIN project's going to be, the first thing that we say to SPIN providers is that we can rearrange as long as you're freeing your fellows on the third Wednesday of the month. So we discourage anyone who's providing the additional role from asking you to be committed at that time. So most of the time we can resolve that. There's been one situation where it was simply impossible because of the way this structure of things work, that we had to excuse those particular few fellows from attending the session. And because we were not offering any alternative, I think it was unfair to kind of hold that against those fellows, because despite their best efforts, they just could not make it. So as a general rule, we want to make sure that the additional fellowship opportunity, and in fact the primary care GP role as well, does not include the Wednesday afternoon. So people who are in primary care and GP, they usually can rearrange their clinics, start a bit later, or just have the afternoon off, or just have paperwork and things which they cash out with afterwards. Different ways of resolving it. But anyone who is starting a fellowship will already know that. It will be on the memorandum of understanding, so they will already know, and the practice and the organizations that sign up to that will know that they have to be free on that particular slot. But if you happen to be in a fellowship that predates those memorandums, so especially people who are in the second year and stuff, they may not have been aware of that. And so, we do take that into consideration.
Thank you, Munir. Is it Benno Maywish?
Hi, thank you for taking my
Hi.
question. So I was working recently to learn a salaried post and do my SPIN program. So my question is along the same line. So when I take up the salaried post, do I have to negotiate the days I will be working on? Because apparently 1 to 2 sessions will be reimbursed. So is it one every week? Would I be given 2 sessions where I have to do my fellowship thing? The second question was, the fellowship program is always 2 years, 12 to 18 months, or is it depend on the program enrolled into?
Yeah, just take the first question. 1 or 2 sessions. You are entitled to funding from the national pot for 1 session per week. If we can match you up with a host provider who are willing to fund a second session, then you can do the 2 sessions a week. But yes, it is a commitment for 1 session per week minimum, and 2 if we can find a supportive host to accommodate you. In terms of the length of the fellowship, we do encourage fellows to join up for 2 years, but we do have fellows that pursue it for 1 year for whatever reason. And indeed, you can choose to diversify at the end of the first year. You don't have to do the same fellowship program for the entire 2-year duration.
So you said 1 session. So obviously 1 week I'll have to negotiate what day is it. So would I be provided with the details of the day that's supposed to be free?
It depends what you're doing. If you're going to an alternative host provider, for example, we've got some speakers coming on board shortly to talk about offers. They may stipulate that it's best that you attend on a certain day to get the best out of the programme. However, if, for example, you're doing a fellowship within your practice, or you choose to pursue a diploma, for example, then obviously there will be specific dates when you're probably required to attend. So it is negotiable, but we'd need to see what fellowship opportunity you pursue before we can answer that question fully.
And the other other question you already said, and somebody asked in the question as well that how does maternity and all these things work when you're in fellowship?
If it's okay, I'll deal with that subsequently because I'm conscious of the time and we have got
Fair
other
enough.
fellows,
Okay.
if that's okay, but I'll make a note of
Thank
it and
you.
I'll come back to you on that.
Thank
Thank
you.
you. Jake?
Hi there. Just a quick question for Charlotte. I'm one of 13 new to practice nurses working in Hackney doing a 12-month postgrad program. I think I read on your website that we'd still be eligible to apply after that period, but I'm just wondering how long we would have.
Well, the eligibility is up to 12 months, so it's any time before that. So we try and align it. We've also been, is that part of the open doors or is that the VTS?
It's the VTS, sorry.
Yeah, so we are already we're aware of the borough-based offers and very consciously focused on aligning it at a point where it completely makes sense for you as fellows. But the idea is actually to put your expression of interest in now. Then we look at your timetable and then we consider the best place for you to start. So we are, very good at making this as flexible as possible within the eligibility window that you have.
Brilliant, thank you.
Okay.
Amy?
Hi, thank you so much. Really brilliant information. I just wondered, if you start spin in one area of London and move to another area of London, do you remain eligible? Or like within the 12 months from CCTing?
Yes. It's slightly more complicated than I could probably do justice to in this particular slot, but yes, you can. It's slightly complicated behind the scenes in terms of transferring funding and what have you, but yes, it can be done. So please rest assured we'll support you.
Possible, but not straightforward. Thank you. That's helpful.
Indeed.
Thanks.
Okay. Fatima?
Hi, my question is about CERT healthcare. I'm not sure if we're still covering that as well. I just applied for that and I'm waiting to hear back for the shortlisting. My question is that with regards to the PG CERT, like what will that add? Because personally, my long-term plan is to be a trainer and be in teaching and these side of general practice. And I qualified last year in August. So is that something, PG CERT in healthcare, that will add towards my training journey, or what will that add to my portfolio?
Linnea, could I ask you to take that question?
Yeah, that's a good question actually, because is it you're interested to become a trainer? Is that what you're looking to do?
Yeah, I like the academic side. So
Yeah.
I am interested, and we already have like a lot of medical students in our practice. So I already teach them during some of the sessions. So my long-term plan is to be a partner and a trainer as well at the same time. So I want to do whatever is going to help me with that.
Okay. The short answer. I'll just comment, and actually Rachel is here, so she can probably answer that question a lot better than I can. I think the short answer is definitely a yes, but Rachel, you can elaborate on that probably better than I can.
Yes, sorry, I've only just joined. Lovely to see you, Munir, and everyone, and the question. So thank you. So it's really fantastic to hear your plans, and also really great that you're interested in being a GP educator in the future. So the PG Cert itself, again, there's a module guide that you can see if you want, but basically it's in health and well-being, and we've tracked people who've done this in the last sort of 7 or 8 years and what's gone beyond that. So it gives a fantastic basis of academic practice. It also helps in system development and system change and leadership in that sphere. So it includes a module of creating and running a system change project, which can be on pretty much anything of your choice that your stakeholders and networks are willing to engage in with you. So very commonly people who've done PG Cert are quite soon future system leaders in their range of fields, whether that be clinical, educational, commissioning, etc. Separate to that, if you want to be an educator, you would then later need to go on our GP educator course, which what's been HEE and is now Workforce Training Education Directorate of NHSE provide. So the PG Cert won't itself make you an educator, but it's a brilliant grounding as a future leader.
Thank you, Rachel. I'm conscious of time. Rachel, could we take one more question? Is that okay before we come to your presentation? If we can take the question from Aaron, please.
So in regards to the study grant, so I'm considering doing the 2-year program. Is that up to 2,000 over the 2-year period, or is it per 12 months?
It depends on which borough you're in. So if you are in Newham, Waltham Forest, or Barking, Havering and Redbridge, you're entitled to £2,000 per year. And if you're in City and Hackney or Tower Hamlets, it's £1,000 per year.
Thank you very much.
Thank you. If I could ask the other people who are wanting to raise questions just to hold those for the time being, please. We will come back to you if we can time permitting. And if I can please hand over to, again, Dr. Rachel Roberts for her presentation on the benefits of the programme. Thank you, Rachel.
No, thank you so much for inviting me today, and it's brilliant to see the number of people on the call. And thank you for sharing the slides, Sarah and others. So really happy to take questions. I've got some slides, but we'll just look very briefly at the detail in those. And broadly, I think the whole reason for setting up SPIN, which dates right back to 2017-18 and prior to the New to Practice Fellowship Programme, was to help support people, the different professional groups, in the really early stages of their career. And actually for London, this is about a permanent salaried role and then the portfolio for up to 2 years. So it's never been about a temporary programme. It's about welcoming people into the workforce and then providing certainly the educational wraparound. So for us, we engaged in discussing with our GP programme directors, because what trainees were telling us is they did feel that support they got during GP training was a really safe space, a supported space, and often described it feeling as falling off a cliff when that finished. So for us, that's why we've in London employed programme directors, and obviously fantastic to have Munir in that role to continue the educationally supported sessions as well as the 2-year portfolio opportunities. So if we just move along a little bit, that's really helpful. Thank you. So this also details that for us, unless we did offer something that people really wanted and found a fulfilling early part of their career, that we weren't going to meet population health needs because we weren't supporting and retaining people early in their careers. And these are the wraparound elements that we really wanted to do, and to look at how that helped people want to stay and work in our system. So do continue with the next slide. So this is just a visual, and again, you'll have probably had explained the elements of the programme, but this really puts in into a visual part. You know, there's that basic support in your practice or in your PCN of feeling welcomed into that team as a permanent and supported member, and then that element of the portfolio and the educational wraparound. So it is now pan-London, and again, the other regions do really look to what North East London have done and London generally to provide that extra support. We just move on, that'd be great. So this is also, I think, a really important piece of narrative. So again, in London, certainly a number of our fellows have 1-session portfolios. What our evaluation showed is that most people feel a real benefit from having a full day in their portfolio role, or for example, on the PG Cert. They also get that. That does require employers to contribute to this, because the national pot is just for the 1 session. So we really encourage this. And so this helps explain to employers, you know, the real benefits that they notice from hosting doctors, nurses, etc. in the programmes, and what that can do for them and the patient care they provide. So thank you. These are then some of the stories as part of our evaluation in terms of what particular fellowships have offered, and some case studies around that. And again, you'll get these slides, so in case that helps, it's absolutely fine to have them. And we're trying to look at this from the perspective of people recently qualified and what they feel it gives them, also what it does give to the employers, and in the enormous contribution it's made to pathways of patient care, because of course this goes right across all sectors. And again, this is the particular narrative of a hospice. Again, if we just move on, that would be great. So there are some further case studies below as to how this also really benefits patient care. And again, that very much helps people feel satisfied in their roles, but also I hope helps give the argument to commissioners and others that it's actually really important to support these programmes, both in North East London and beyond. So again, a few quotes there from people that have been in a fellowship and what they feel it's helped them to do in terms of delivering care. So thank you. Again, fantastic narrative here from Chi Ling as to what she's done in North East London in terms of developing integrated children's care, and really her narrative at the bottom of why she potentially would recommend fellowships and what she found it gave her. Again, just moving on. So absolutely the narrative we had. So we had an external evaluation and 450 people were interviewed across London, sort of fellows, hosts and employers. And absolutely they all said it dramatically widened their horizons and their opportunities to engage right across systems and networks. And again, as mentioned before, that could be clinical networks, it could be educational, it could be into all sorts of planning of services. And again, that's very much up to you and also the people hosting you as to where you feel your energies and skills either lie or that you wish to develop. Just carrying on. So these are a few headlines of that external evaluation of the 450 people. And as you can see, that 90% felt it was more likely to make them want to stay working locally after the 2 years of portfolio was complete. And again, that increases people's likelihood to want to stay in general practice. A few did move out of London for various other family reasons. And again, a really high level, 95% feeling it helped them learn more about wider systems and also that joint working across organisations. And 97% felt it had made them feel much more supported as a newly qualified GP. So when this was done, there were less nurses on the programme, and we would want to hear more from them as well going forwards. And interesting, 100% felt that the fellowship had helped them build additional skills. Again, there is a link on there to the full evaluation on the website. So just moving on. So yeah, it's about where you feel your skills either lie or where you want them to lie, or even where you feel there may have been a gap that's not as big as advanced as your other skills, and that you actually want to develop that. And that comes to one of the questions just a minute ago of what people are hoping for their future careers. So moving to the next slide, there's a few of the roles that recent fellows have moved on to take. And it just gives small examples. And again, in that educator pathway, so you've got one of them who's now a GP trainer, appraiser, the chair of the local training hub, as well as being a SPIN programme director themselves. You've got a whole range of other leadership roles, whether that be clinical or around governance, and senior system leader roles that they've gone on to. And again, not everyone will want that kind of role. They may just want to feel more supported or more satisfied in their current role, and that is absolutely brilliant as well. So again, just moving on, if that's okay. So the people here are on the call. So Sarah, Charlotte and Munir, so the people to speak to about this, and it's really that signposting. And a massive thanks to the entire team in North East London that support this, and to everyone who engages with it, because the difference you're making to whole systems and patients is enormous. And so I'd like to just go to the final slide and say a big thank you, and also to Sharon Kelly, who helped create these slides from our team in Workforce Training and Education, NHSE or HEE. And yes, if we take those down, if anyone's got any questions, please feel free. And thank you for inviting me today.
Thank you, Rachel. If there are any questions, we can take those now before moving on to the next part of our agenda. If not, we will move on. So we're now going to hear some of the success stories from our current fellows. They're going to share some of their experiences over the last year or two. And if it's okay, we will start with Dr. Jeeves Wijesiri, if he's still here. Are you here, Jeeves? I did see you earlier. If not, perhaps we can go to Dr. Ben Davis.
Hi, afternoon.
Hello.
Can you see and hear me all right?
Yes, thank you.
Yeah, great. So I'm Ben. I'm coming towards the end. So I CCT'd in end of my first year. So I CCT'd in September last year, and I was a City and Hackney trainee. And I have carried on. Basically, so I'm doing a spin at Homerton Hospital, where I've been kind of before. So mine is sexual medicine. So I'm training as a sex and relationship therapist. I used to be an obs and gynae trainee, and the fellowship has enabled me basically just to go and do something which there's no way in other way, like in the NHS, I think it would happen. So it's enabled me to, I do the psychosexual assessment clinic in Hackney, which is separate from my sex and relationship therapy training, but I run that with a clinical sexologist, a sex therapist, and we run that clinic together. And so the fellowship, I guess, is just to say, if you've got a previous interest or previous training, just gives this huge freedom to go and say, okay, what job would I really like to do, or what could I do in the hospital which aligns with my interest and is building on something perhaps you've done previously. And then, the offer to the hospital of saying, well, I'm free, you don't have to pay me, I'll come and do this clinic, and I bring, this is what I'm bringing. It is an amazing opportunity for them and for you as the fellow. So it's been really good in terms of having a different space, and really contrasts with my GP work. So I do 4 sessions in Hackney in a practice where I was a trainee, and then one session in sexual health clinic. And in that clinic I see 4 patients in the morning, which they're extended appointments. And I get to bring loads of GP skills. It's very holistic. It's very thinking kind of body, mind, medicine. But it's an amazing opportunity, and the real skill of which you can bring from GP into the specialist setting. So for me, it's given me a lot of freedom. It's really kept me, certainly keeping me in for that 2 years into GP. If there are moments where I think, not sure, it's been really good to have that as an alternative opportunity. And I guess the last thing to say is just be as creative as you can. Like this kind of opportunity, I think, is really rare in the modern NHS. It feels like everything is no funding, no money, and this is essentially an opportunity to go and do something, go and make something, like go and do something creative, and that is a really special opportunity. So I can't recommend it enough. And then I'm sure other people say, but the peer support and carrying on, Jeeves is on VTS with me, and just you don't have that support of VTS anymore. So having peer support, coming to the sessions is also helpful, and Munir's support. I'll leave it at that. It's probably enough.
Thank you, Ben. Sarah, are you still there? Or?
I am having a few technical problems.
Yeah.
Sorry, can you hear me?
Yes.
Okay, thank you, Ben. Jeeves, could we pass over to you now, please?
Sure. Yeah.
Thank you.
Thanks for the opportunity to come and talk about this. I've done 2 of the opportunities that have been talked about so far today. One of which was the PG cert, and the other is I've also taken advantage of the spin opportunity in many ways, actually, really thanks to Sarah, who kind of really helped guide me through this process. I agree with everything Ben said in terms of taking this opportunity with both hands, really. I cannot recommend to you enough doing things like the PG cert or taking up this opportunity, because it gives you the ability to get a jump start on your future career. And I think that is, as has been said, really rare. The PG cert is a really fantastic opportunity, not just because it's an additional qualification, which, I think is valuable to some, but because it gives you the opportunity to take up a project where you are able to do something that interests you in a primary care or larger setting, but where you're also supported by clinical academics in the field that help you think differently about how you might approach a project. You will gain skills, you will gain so much from that process, but what you also do is meet loads of like-minded people who are interested in quality improvement. And one of the things that I think perhaps, there are many positives that have been talked about, but I think that one is so easily lost. I'm still in touch with a lot of the people I met on that PG cert. We still talk all the time about projects that we've gone on to do thereafter. I was doing some project work because it was the tail end of COVID, looking at creating resources for migrant communities like those in the community that I was looking after in general practice. And I worked with a charity that worked predominantly in the developing world called Medical Aid Films, who had experience of doing that alongside patients that are not English speaking, to create digital resources that could be shared remotely, but be in the cultural context of those populations. And together we worked with clinicians, patients in the local ecosystem, but also with organizations like Migrant Health, all of these different groups, to create resources that could be used practically in Hackney. That was really, really powerful. And together we managed to, with the support that we got from Mary and some of the team at Canterbury who support the PG cert, it gave me the time to be able to do that, but also a different lens through which to look at it, an opportunity to talk to other colleagues about it. And we went on to get huge amounts of funding from other organizations to launch that on a national basis and expand pilots to run that in multiple different languages for different communities. Off the back of that, I then ended up going on to get a job over at NHS England doing vaccination and screening. So I work for the vaccination and screening programme as a clinical advisor. I have done for about 1.5 years now, if I'm honest. But a lot of that has been, with relation to the work that we did on that PG cert and the project that I did. So it gives you a real jumpstart. It gives you something that you can talk about when you apply to roles like that. And it may be that you do something clinical like Ben is doing in that kind of sexual health field that, otherwise wouldn't necessarily have been supported. But it also can be an opportunity for you to get involved with quality improvement, health policy, education. Many of my colleagues have gone on to do the SPIN programs like the GREAT program or other clinical programs where you get direct experience teaching and paid for the time that you spend, which is such a rarity, especially now, at a commensurate rate with your clinical role. Because that's the other thing, is often you end up giving up part of your pay, which early in your career, when you're saving for other things, when you have lots of other competing interests, is difficult to do. I was very fortunate because I happened to have a conversation with Sarah about it and said, look, I do this work for NHS England. There's potentially an opportunity in primary care. And she sort of moved heaven and earth to make it work with the NHS England team. For anyone that's worked with NHS England, it's not an easy thing to do at the best of times. And together they agreed on an honorary contract, and all the process and my practice were kind of wrangled into supporting me for a half day a week doing this role, this opportunity, at a time when NHS England were cutting back on roles. Actually, to have someone who can come in for free is really attractive to organisations. And it meant I could go on and now do a bit of work in primary care off the back of this, largely in areas around community pharmacy. I won't bore you with the details of my projects and things, but it enabled that to happen. And those opportunities can be really rich for you in terms of understanding holistically what's happening within the system, within the health service. And it gives you the opportunity to really constructively engage with something beyond just the kind of direct patient contact, which I think is, fantastic and keeps you grounded and gives you perspective, but gives you that macro level of top-down understanding how policy is delivered, developed, and how services might be commissioned and operated at that level. So, I would say to you, don't hesitate to do the PG Cert. I really recommend it, not least of which because it's an incredible sum of money to support you to do that. And because it is a grant, it's tax-free, which is also pretty spectacular and unique. And will facilitate you meeting loads of people that are similar to you and will want to do those things. And those contacts stay for quite a long time afterwards. With the SPIN program, it's a really great way to follow on and take something that's a project and go on and do something else slightly different. It's a really great opportunity. The team are really facilitative. They want to see you go and do things. So even if you're at the point of saying, here is an idea, it's worth having a conversation about that idea, and they'll help try and make everything fit around you. Be prepared for the fact that there are sometimes issues around things like study budget and getting access to some of those bits and pieces, because that's, I think, been being upfront about it. I think that's been an issue for a few years for people because of the way the funding is organized. But if you can live with that, actually the rest of it is fantastically positive and a really great opportunity. The Wednesdays are really fantastic in terms of meeting other people, and it's a great way to just have a bit of a natter. For me, even now, yes, we go to those events sometimes to deal with the content of what's being taught or whatever it might be. But for me, it's just an opportunity to kind of have a bit of a catch up with some of the people I've done the program with, or some of the people I've encouraged to do it with since. And it's just a fantastic resource for that. I've talked for absolutely ages and I'm going to stop now. But honestly, I cannot effusively enough tell you that this is a great opportunity. And it's so easy to be cynical with these things and look a kind of gift horse in the mouth. But what I would say to you is these are two really fantastic opportunities. Please take them up, because it will give you something else that will keep you in general practice at times when it can be really hard. Actually, that variety will, I think, be really positive for you, and it will help you in the future. Thanks.
Thank you, Jeeves. No greater promotion than from a current ambassador. So thank you. Really appreciate you coming on to speak today. Nick Alexander, I think you're here. If you could give us a little overview of your fellowship experience, that would be much appreciated, please.
Lovely. Thank you so much for having me. So I'm Nick Alexander. I'm a GP in Tower Hamlets. I'm coming to talk mainly about the PG Cert. I'm coming at it from a slightly different angle compared to Jeeves, who is obviously a high flyer, bit of an ideas man, whereas I think I went into it with quite different expectations, quite different aims, and I actually didn't have an idea of what I wanted to change going into it. The thing that kind of made me want to do the PG Cert was some experience, some knowledge around things like leadership, as well as some knowledge about kind of the workings of the NHS. And, we've had some really great experiences. Not only do we have the lectures from Canterbury Christchurch, but there's also sessions with a HE tutor, someone who's done this course a few years ago and has, used it to go on and do some really interesting stuff. So, it's I think there are lots of benefits to doing this. For me, as I say, I wanted to kind of learn more about leadership to develop my skills. I'm coming to the end of the PG Cert now, and have built up some knowledge, some confidence, most importantly, and I'm running for LMC in Tower Hamlets, which I don't think I would have done without the confidence of having done this. There are some really amazing kind of tutors. There are one kind of drawback, unfortunately, is that there are some assessments, so 4,000 word essays, 3 of those in a year. Important to say that so that you know what you're getting into. They are quite interesting once you start getting into it, but for me, it was a bit of a kind of a blast from the past, felt a bit like going back to uni in that sense. But, you know, some really interesting insights into myself in terms of kind of, so the module that we've just done looked not only at things like leadership, but also things like emotional intelligence, things like how you handle conflict. So really eye-opening and really, I guess, something introspective that will only help you going forward. I didn't have an idea of what I wanted to do in terms of a change. I kind of went into it, as I say, not really knowing that was something that I needed an idea for. And I went for something a bit smaller scale within the practice. So really looking at total triage within my practice and trying to look at efficiency. For those of you guys who work in total triage practices, you know that sometimes it can be a bit of an inefficient system. You're giving them a phone call. Can you come in? I really need to examine you. No, I'm not available today. Can you come in tomorrow? No, next week. You know, it feels a bit kind of secretarial, but it also feels a bit like you're wasting your time. So my project was really looking at, could we start thinking about certain conditions that, you know, you ring up or you put through your AccuRx, and let's just get you in. Let's see you, deal with you in one appointment, a bit more kind of traditional GP. And that's kind of in the works at the moment. There's obviously been some challenges along the way. That is something that I'm doing within my practice, so not quite to the amazing scale that, you know, Jeeves has perhaps done. But, you know, I think the important thing to say is that this is kind of a really good opportunity to learn about a different dimension, something that is not taught in medical school, that is not really promoted within things like VTS, foundation school, and, you know, equipping you with the skills to go on and be a leader in the ICS, in the LMC. And it doesn't necessarily have to be that, you know, so one of the girls, so the HE academic tutor, actually used it as an opportunity to go and do some stuff in digital healthcare for a bit, because that was an area of interest for her. So it really does open doors, even if we take it back a few steps and say, you know, I'm early on in my career. I don't necessarily want all of that. I want to be a jobbing GP, which, you know, is absolutely fine. It will increase your confidence. It will give you an idea of how the NHS works. And is a really good way of meeting people who work in other parts of London outside of North East London, how their practice runs, you know, what challenges they face, how they've kind of changed things. And if you're like me, a bit of a kind of sorry, that's my cat in the background. If you're someone like me who's a bit nosy, you know, who thinks there are things that we could be doing better, I think it gives you an idea of things that you can maybe go and bother the partners with. Or, you know, if you're thinking of being a partner in the future, you know, some ideas that you can use to take forward, make your surgery, your PCN, maybe even your ICB better. So, yeah, I think that's as much as we can say about the PG Cert. I think the bullet points to know really are I'll let her out in a minute, she will stop. The bullet points to know really are, you do get a tax-free bursary, which is really nice. It is probably the equivalent of more than the 2 sessions that you spend on this. Gives you an opportunity to network outside your local area, meet people from different places, share ideas. There are some assessments along the way. There is reading. It's not a DOS. I'll confess that I maybe thought it might be, and that was a bit of an eye-opener for me. But, you know, it's a really good opportunity, and I would really encourage you guys to do it. And finally, this is obviously as a recruitment event, I would also say North East London, fantastic place to work. Lots of variety, lots of different areas. We're recruiting in Tower Hamlets, lots of places in Hackney, Waltham Forest, Newham, so don't be afraid to kind of move around. I'm not someone who trained in Tower Hamlets. It's been a bit different getting to know different people, different ways of getting things working. But I think this opportunity, along with being in the First Fives community, has really helped me to feel more at home. And yeah, I think that's probably enough talking from me. Thank you very much for listening.
Thank you very much, Nick. That's great and really insight into the PG Cert. So much appreciated. And I'm now going to hand over to Dr. Tessin Khan, who joins us both as a fellow and a potential host provider. So he'll be speaking through his experiences in the fellowship programme and then enlightening us a little later on about opportunities that he has for fellowships going forward. Thank you.
Thanks, Sarah. Hi, everyone. So yeah, my name's Dean. I'm a GP in Hackney, and I just wanted to talk about my experience as a fellow, which was a standalone fellowship that I did around sort of 8 years ago in Lambeth. So I've been qualified as a GP for around 10 years now, and started off doing salaried work, 8 sessions, which was possible back then. I don't think I know anyone that does 8 sessions a week anymore. I think 6 sessions seems to be the new full time. But I then, after that year, kind of experimented with lots of different non-clinical roles, just to see kind of what I wanted to complement my clinical time with. And then the following year, I actually moved to London to start a population health improvement fellowship in Lambeth CCG. So as part of that, I was funded to do a master's in public health. I did 2 days a week in the GP practice, and also a project based at the clinical commissioning group, looking at the NHS health check programme. As well as this, there was peer group, there was leadership training, coaching, and just like I think Jeeves, Ben and Nick have mentioned, I think it's really important, and I can't really stress how much value that brought for me as a GP, as a relatively young GP, and it really did change the trajectory of my career. It opened up lots of different opportunities. I think again when Jesus was talking, it kind of there was definitely a familiar story there, in that you start doing one thing and it leads to another thing and it snowballs. So I started off with this fellowship. I then moved to Hackney in 2017 and helped set up the neighbourhood programme, which was the precursor of primary care networks. Got involved in childhood immunisations with my public health kind of experience. And then when PCNs came along, I became the clinical director of our PCN in North Hackney, which is a role that I'm still doing. And that's been a hugely interesting experience, kind of doing a lot of operational stuff, managing, recruiting staff. So I managed to recruit sort of around 21 members of staff in the network, diversified, the team here, so that actually we can try and reduce inequalities. So where I'm working in North Hackney, we have the UK's lowest immunisation uptake for childhood IMS, and actually COVID and lots of other prevention activities. So there's a lot of work to be doing here. So it was a real opportunity to get involved with that. And I then got seconded to NHS London region around the COVID vaccination programme around 2.5 years ago. Again, and like Jeeves, sort of this was working with stakeholders such as the Mayor's Office, media kind of interviews. I ended up having morning radio discussions with Vanessa Phelps and having community TV channel weekly slots on health issues wider than the vaccination programmes, because I think that was the recognition that actually if you just focus on vaccinations and people aren't really interested. So it's all about sort of population health. And again, the reason why I'm mentioning this isn't just to roll off a list of all my achievements, it's to really kind of to link it back to the fellowship programme that really helped me develop those skills, develop those contacts, helped improve my leadership skills. I went on a QI course as part of that up in Sheffield for 6 months. So it was really the start of the rest of everything else that happened after that. And I think that's what I really want to emphasise, is that you know, it really does open up doors, and I think it really helps, particularly at a time when general practice is difficult. We know that. I mean, you know, a lot of people are leaving. I certainly lost 2 or 3 GPs, and we can't recruit any additional GPs. So it's a problem up and down the country. And I think that this is a way to help diversify your career and help you develop additional skills that can help break up your week. Initially, I know when fellowship started and portfolio career started, people were nervous that actually it would take people away from the front line and reduce the amount of clinical work that people do. But my experience has been that actually those people that have portfolio careers and that do fellowships are more likely to remain job employees rather than succumb to, for example, burnout due to doing too many clinical sessions, which is a real risk nowadays. So in terms of, I guess, downsides or what I would say the most difficult aspects are, I mean, I really can't think of any negatives. I guess one of the risks is that if you are like me, and I think a lot of speakers today, where you are interested in lots of different things, the opportunities will come your way and you'll have to learn how to start saying no, because actually it's, you know, you only have a finite amount of capacity. So don't do what I started doing and overburden yourself with taking too much on. But it's a really good way to reflect on what stimulates you to try to develop specialist skills. And so I really wouldn't hesitate in recommending a fellowship. And it really, like I said, has changed my career. And I'm sure that all those people that I trained with as well, they've all gone on to do lots of exciting things, both at sort of regional level, national level, and ICS level more recently as well, since they've been set up. So I think I'll leave it there. I don't want to repeat some of the other messages that I think we're all kind of saying the same thing, and happy to talk about some of the other opportunities in North East London afterwards.
Thank you, Tasim. That's great.
So shall we move on to the next agenda item then?
Yeah.
I think Claire is here. Claire, do you want to take over?
Hi, my name's Claire Davison. I'm a GP in Newham. And I've been a GP in Newham now for 30 years, which is quite a long time. And during that time, I've been involved in some diabetes service redesign back in sort of 2000, 2010, and then some practice turnaround. And then more recently, getting involved in urgent care. So I was very interested in getting some fellows to come and join us looking at urgent care, because it has so much to do with the front door of primary care, as well as trying to make sure patients get the right access at the right time. And our experience is that when they tip into 111 and the urgent care system, they often start going around in circles, and it creates enormous cost and inefficiencies and diverts resources inappropriately. So it takes about 6 contacts to close their issue down. But those of you who work in Newham will recognise that Newham's a very young population. So we have about 100,000 patients under the age of 18 in Newham, and they're very high users of our urgent care system and of our UTC and 111. And so we have been trying to find ways of managing that same day urgent care, which everybody's talking about now. And I'm sure it's very familiar to everybody in this meeting. And I'm sure you see 111 appointments every day and you think, why has this patient ended up in my clinic? This is not appropriate, etc. So originally we were focusing on trying to bring on some young leaders and develop them to understand the urgent care system and the interface between primary care, because it is so merged at the moment. But then when we analysed the activity in our 111 system and our urgent treatment centre, we recognised there was a disproportionate amount of activity coming from our children. And so we thought that was an area we should focus on. And our Children's Commissioner in Newham has been particularly engaged with this. And so they are very keen to support the Children and Young People's Urgent Care Fellowships, and there are 2 positions available. And it is relatively fluid, to be honest with you. We have, the concept is that there'll be 1 session of service delivery, but then there'll be 1 session of self-development. And it's been very interesting listening to the talks by the previous fellows and the different opportunities that have arisen for them and how they've sort of been able to drift into the area of interest for them. And I think that's very much what we want to provide with these roles. There are various opportunities, and it's really for you to come and join us and then find which particular area of care interest you. So it might be thinking much more about, you know, how the management of the front door of primary care could be improved, and how it can support same-day urgent requests from children and their families. It might be that you'd be much more interested in being based in the urgent treatment centre, and there might be some opportunities to work with paediatricians at the front door as well. We'd also really be keen to have people who are interested in data analysis, looking at the cohorts of patients that are presenting and if there are particular needs that aren't being met, and that they might create opportunities to develop services in the community that would prevent those patients needing or having contact with the urgent care system, because we find that when they do, they get over-investigated, over-treated, over-referred. And it, you know, it just escalates care, when actually a lot of the things with GPs and the experience that you guys are developing, you'll recognise that you're developing those skills in risk management and appropriate care, and also having that more holistic view. I don't know, I don't really want to throw lots of information out there, because I think it's really saying there is, you know, it really is for people to find their own path. If they want to get more involved in the acute side, there will be opportunity for that. If they want to get more involved in looking at how the front door of primary care can work, or how we can get the data analysis between primary care and the urgent care system, and to get those to flow properly. But I think it really is about service improvement and learning. And on a personal level, as I said, I've been working in Newham for 30 years, and I think it's really great to hear how the other fellows have found that these opportunities have helped them navigate the system. And that means that when you want to influence the system, you'll be more able to, because you'll probably have the relationships and the contacts or the go-to places to have that influence, and then develop your own leadership skills. And certainly for me, I think we need to have some succession planning in our leadership in Newham. So we had a great cohort of leaders who are all now in their 40s, and so we need some new blood. And so it's, you know, trying to develop the opportunities. And if anybody's interested in just doing overall urgent care, I'd be very keen for people to get involved in that as well. And with my GP urgent care lead role, if people are interested in that aspect of care, you know, they could easily sort of shadow me. I run the urgent care working group where we have all the stakeholders present. And so if you wanted to do some shadowing and have exposure to that, and also we do want to start developing better links with our neighbouring boroughs in Tower Hamlets and Waltham Forest. And so there are 2 urgent care leads there. And so we're going to start trying to work more collaboratively, whilst recognising each system is a little bit different with the new place-based partnerships, etc. But I don't know if there's anything else that you would like me to add. There are specifics on the website, so I think the detail of the offer is on the Training Hub website.
That's great. Thank you very much, Claire. Are there any questions? I'm sure there might be at the end or subsequently, so I can obviously refer you to Claire if you have any specific queries about the fellowship opportunity. But thanks again very much for joining us, Claire.
You're welcome.
I'm now going to hand over to Dr. Venkat Thiagarajan, please.
Thank you. Hi. Just to say, I have my other colleagues, Sanjeev and Maria, who I believe are sort of the current SPIN fellows. I'm one of the lecturers in Queen Mary's University, and they are my wonderful colleagues who I've had the pleasure of working with, and hopefully will continue to work with. But they've designed the presentation, so I'm hoping they will take the lead on it and deliver it. I'm happy to chip in as needed. I've had a look at the presentation myself, so I'm not completely oblivious to it. I just had maybe one line I just wanted to tell everyone, and I think I don't know, maybe the sort of the members here who lead the SPIN fellowship probably will emphasize this. I do want to make the point that, you know, when you think of fellowship as a concept in secondary care in the States, or in as a speciality, it's very seen as a very prestigious thing. It's seen as something that is an aspiration for people to subspecialize in what they want to do. And rather than, I suppose, labeling this as a sort of venture that you're taking outside of GP, I really want you to embellish the speciality of general practice. And it is a specialism in its own right. So we are going to go out there and hold our heads high after you deliver this, after you gain the skills, after you have the qualifications. So, you know, as I would say, hopefully in the endeavors that you do pursue, you know, and then through the SPIN program, you will get the aspiration, and we'll be proud of the fact that you are going to be a specialist in primary care. And that's all I really wanted to say about, I suppose, the aspect of fellowship. if it's okay. So Maria, Sanjeev, and Urva as well. I apologize, I didn't see Karan. Is Karan here? He's not here. He's our comrade who's not with us today. He's on planet Earth, but he's just not here today. So I'm just going to hand over to them if that's okay, so we can deliver this. Well, they'll deliver this, and I'll be in the background. Is that okay?
Yeah, thank you, Venkat. So my name's Sanjeev. I'm one of the Spin GPs at the moment, doing the fellowship at Bart's program. And thank you, Venkat, for sort of introducing us. But I'd just like to say, essentially, this is a Spin fellowship in medical education, but in a really, really fun, supportive environment at probably the best university. Next slide. I don't know. So it's led by Dr. Dayton Evans, and then Venkat and Anna are two sort of leads day to day, your points of contact to speak to anyone about the Spin program. So like I said, this is a fellowship in medical education, and the reason I chose, well, firstly, really enjoy teaching. Done a lot of bedside teaching, and you often get trainees coming in. You just sort of get thrown into it. You don't really get taught on how to actually. I thought being affiliated with the university, getting centralised teaching third year medical predominantly was just this exciting opportunity that I couldn't really afford to miss. So I signed up to it, and I've enjoyed every single minute of it. It's been like the highlight of my. It's every Friday. It's a nice way to end the week, and it's just been so much fun. Everyone's been so supportive, and it's got that you get your foot in the medical education door. You can open up lots more opportunity in Barts, but also elsewhere if you want to go outside of London or other parts of London. Alongside the teaching and it's clinical skills and communication skills predominantly, but you do get this accredited qualifications in some of the modules led by Queen Mary. So the CILT, which is Certificate in Learning and Teaching, which leads to AFHEA, but you do have opportunity to apply for the Fellow of Higher Education. I haven't actually yet enrolled on that. I'm going to do that in September. We will talk about that in a bit more detail with Mario taking the lead on. And also what's nice is, as I said, it's such a fun, really nice team. There's recruiting 6 teaching fellows. I'm going to continue on, and Irva's going to continue as well. So there's 4 opportunities to. So it's based at Barts Hospital, Robin Brooks Centre within Queen Mary, University of London, Barts Barts School of Medicine and Dentistry. Nice central location, really well connected. Really grounds. And I thought this was quite interesting. The Royal College of GP, their coat of arms, have actually adopted the Barts Shield, St Bart's Hospital. You've probably seen the centre there. So just another nice little link between Barts and being a GP, and just thought that was quite cool. At the Robin Brooks Centre, so that's where we're going to be based mainly, sort of purpose-built teaching labs and sim suites. So it's a really nice environment to actually students. You really do feel like a proper educator, not bedside teaching. So helped deliver quality teaching to students. So yeah, mainly teaching 2nd and 3rd year medical students at Barts. You will be able to teach 1st years, 4th years and 5th years, final years, but it's mainly going to be the clinical and community students. It's small group teaching, no more than 10 students, and it was Friday mornings or afternoons, depending on which cohort you take on. The clinical examination skills and procedural skills as well, I think Irva's going to touch upon next. Sorry, like I said, mornings and afternoons, they're the timings if anyone sort of has childcare or any sort of logistics to get through. The first sort of part of the year, or the academic part of the year, is mainly teach. But then when you come to the end of the academic year, there's more emphasis on mentoring and development. So your own sort of development, you can help with the curriculum, for example, or your own teaching needs. And for that, the timing is going to be a lot more flexible. So you come in really as long as everyone else is perfect. Yes, please. Yeah.
Thank you. So yeah, in terms of the type of things that we're teaching, Sanjay some of it, but just a bit more detail. A lot of it, so each thing tends to be about 2 weeks. So you do get a chance to have a go at it, and then we everyone's really supportive. You can come back, have a discussion. There's opportunities to observe other people, have yourself observed and get some feedback, and then redo that same again and again. So there's a few chances usually, like I said. So for example, if you're doing cardiovascular teaching, it tends to be run over 2 Fridays, and again respiratory over 2 Fridays. So it's quite nice to be able to try and give it a go and then try and improve as well. So that's quite handy. And then there are opportunities here and there where you have sessions without the students, and more for your own development and training, and those can be quite fun as well, to feedback to each other. It's a very relaxed environment as well. And even opportunities, to be honest, to try and help with organisation or review of some of these teaching sessions as well. It's basically whatever you make of it, want to get involved with. So there are opportunities to do some practical teaching procedures as well. So things like venipuncture, cannulation, catheterization. That was the session that we did just amongst the people training as well. So there's a lot to do, and sometimes these sessions do happen outside of Fridays, and you can swap into them if you want to. So yes, there's sort of all this teaching planned, but there is still some flexibility to it depending on what you're interested in. And then yes, the communication skills teaching is good fun. You get to do sort of consultations, so the students will obviously have a go, would get feedback from the rest of them. We have actors come in. So it's quite nice. There can be different themes for that as well. So like breaking bad news, culture and diversity as well. So there's a lot of variety in the kinds of things you'd be delivering as well. And Sanjeev mentioned this earlier, but there is multiple opportunities throughout the year, and more so specifically in the second part of the year, for your own development and mentoring as well. We do weekly debrief sessions after the sessions. Again, it's quite nice to bounce ideas off each other. Have monthly mentorship meetings with the wider team as well, and like I said, the observation and feedback as well is quite handy. Yep, so I'm going to hand over to Maria, who will tell you more about the SILT programme.
So hi, yeah, so many of you might know me already. I'm Maria. I'm working with Urva, Sanjeev and Karan, who's not here today, and also Venkat. So the Certificate in Learning and Teaching, personally, it's a great module to be doing alongside this fellowship, and it's supplementary, so it's a bonus to being on the fellowship. It's Certificate in Learning and Teaching. It's an accredited programme, so that if you were to sort of take it anywhere else, any other universities, it will be recognised that you've done this qualification. It's 2 modules, and it runs from January to January, and you have 2 assessments for each module, but they're really not arduous. So they're all involved with the lessons that you're doing already, about designing the lesson and the lesson delivery, and it gives you the education and theories of how to sort of design lessons, and essentially why the teaching is designed as it is, what's the evidence base behind it. And I know, like Barts is like, you know, it's a really old institution, but you'd be really surprised that there's lots of research going on behind the scenes to kind of redesign the curriculum, redesign these sessions and keep it as up to date as possible. And this is one of the qualifications that will give you like a solid understanding for that hopefully one day that you can also use it to become part of the university and be involved in those critical decisions. So yeah, it's a really, it's a good opportunity to have this on your CV as well, and then use it to pursue the higher education associateship as well. So I would definitely say this is a bonus as well as part of the fellowship as well. Yeah, and this slide is just telling you about how it's built up. I think the slide's quite wordy and it makes it sound like it's quite a lot. It says 300 hours, but if I'm honest, the modules are really short, and the weekly workshops, they're probably about an hour to an hour and a half long. There's quite a lot of reading that you would do in your own time, but it's flexible, it's adult learning, so it's as much or as little as you want to do, and it's also can be tailored as to what you want to design and deliver. So if you're a keen bean, go for it, do the 300 hours if you've got 300 hours. But if you haven't got the 300 hours, then the minimum you can do the workshops and then the recommended reading from that. So it's a lot more flexible than what this slide alludes to. Next slide. And this is just telling you a little bit more about the Fellowship of Higher Education Academy. So it's a recognised commitment and qualification. Most universities will recognise it. And actually this, you get it as part of the Certificate in Learning and Teaching. So it automatically leads you on to that as well. So you're getting almost 2 qualifications within this fellowship as well. And you can use it to kind of pursue further sort of educational posts should you wish to, or apply for further fellowships within the university as well. And I'm going to hand it back over to Sanjeev just to wrap up.
Yeah, do you want me to chip in here? So just a few other things about we've mentioned about the scholarship and things and the mentoring, and there's so many other things, the other benefits of doing this fellowship. So you've got again, it's sort of being reviewed at the moment, but potentially there was a scholarship program this year and there may be one next year that you take part in, and just regular development sessions. The team is amazing and they usually involve and invite you to a lot of other things going on outside of spin, And yeah, it's entirely up to you whether you want to attend and take part. And there's also opportunities to become an OSCE examiner. They provide training for that, and there's plenty of opportunities to book into examine OSCEs. I think all of us actually have done that, and it's good fun as well, and it's nice to be on the other side also. And again, the benefits continue. So you do get an honorary contract as part of the fellowship, and access to all of their facilities, such as the Path Museum. There's library on site. The library comes with a lot of courses for literature searches, access to all of their online bank. And we keep saying this, but honestly, it's the most important part of it. It's just the team is amazing. They're fun, supportive, and it's just like Sanjeev said, just a really nice way to spend your Friday. And we had some visuals of the Path Museum if no one's ever seen it, and that's the library. Again, if you've not been to it, it's quite impressive. And yeah, so that's the summary in terms of why. So it's a great way to build your teaching portfolio. Really, really rewarding. There's so much you can bring to the teaching as well with all your experience and putting all of that theory into context. Again, fun, amazing, great team. And yeah, that's pretty much, the only next thing to do is just to apply.
Sorry. I just had a couple of things to say at the end, but I'll wait for everyone to finish, and I just wanted to wrap up for... Sorry, do we have 2 more minutes, or is time up for it?
That's fine.
Anything else, guys, or guys and girls?
Yeah, that's everything.
Yeah. I just really wanted to emphasize that again. This for me, as I'm speaking about this SPIN sort of fellowship in what we're offering, I'd like to think it's a fellowship in the field of medical education. It's in this part unique. You get to come back to the university teaching sort of substratosphere. For some of you, university may have been a good experience. Some of you may have been a less than ideal experience. But I suppose this is your chance to change that narrative of that, what you hold about your university experience by doing it and delivering it, being the change that perhaps you wanted to do or have seen done when you were a student. I'm just going to post subsequent links, and I'm just going to talk about them very briefly for 10 seconds. This is the SILT link. I don't know if it's outdated or not, but I just managed to find it on the Queen Mary Academy website. Again, it's all to do with the number of credits for each of these qualifications, and I'm very keen that anyone in the SPIN program with our department in Robin Brook Centre has access to what you will get out of the end of it. The PG cap is a slightly different qualification, which is done over a longer period of time, and we can have discussions about it. So when you come out of hopefully either 2 years, or if you spend another 2 years with us informally, potentially you can go on to that. This is my understanding of the fellowship. This is another link that you can read about. Remember that any fellowship program, you should have that sort of title at the end. Not that it's about titles, it's about the skills learned, obviously. But certainly this is something you can append to the end of your name and say that, look, I was part of this fellowship. The medical education sort of aspect is driven, and I think this, I want to address very briefly the question by one of the other GPs about becoming a trainer. The Academy of Medical Educators has sort of professional standards, and to my understanding, a lot of these standards are used in the different training programs. If you're training medical students, in hospital doctors, training in GP trainees, if you follow these sorts of standards, when you go on to apply for jobs in medical education, these are the standards by which you'll be asked about the questions. They'll ask you in the interview, oh, how would you plan a session? How would you deliver? What is pedagogy? What is scholarship? What is this is the document that I will be, and we will all be hoping to aspire to get you ready for hopefully a future career in medical education. This is hopefully just a sort of launch pad to it. It's not going to be the full comprehensive package, but for me, I'll do my best, and I'm sure all of us will do our best to guide you in your sort of journey towards medical education. It is very fun. It is very relaxed in the sense that you have, I suppose, time to spend speaking to students. It's also time for you to reflect on your own sort of student life, and I genuinely believe that that's something I did when I first started this post. I am a GP for 2.5 days in sort of inverted commas daytime GP. I do a couple of sessions out of hours, and I do 2.5 days as a lecturer. So this is my inverted commas my dream job. Okay, and I think this post I can offer you, the opportunity into the dream job, and I'm gonna, I'm always there to do my best to help any one of you who sort of joins the program. But I really hope, if not all, a lot of you apply, and I wish you the best of luck.
That's brilliant. Thank you very much, Team Barts. That was a fantastic presentation. Very enthusiastic, which we love. We are running slightly ahead of schedule, and we have been joined by another one of our host colleagues, Dr. Louise Uni, who runs the great programme at QMUL Barts. And she's very kindly agreed just to do a quick 5-minute overview for us before we move on to our next presentation scheduled at 2:15. So, Louise, thank you very much in advance.
Can you hear me?
Yes.
And can you see the screen? That's our website.
Yes, thank you.
Yeah, hi there, everybody. Great to be here. I'm Louise Uni, a clinical reader in medical education, Barts in the London in the community-based medical education unit for the last, since 2011. And I work with Dr. Rafika Lee, who is a clinical partner locally and also heads up his PCN. It's a little bit similar to the previous program that you've heard about, but this is about teaching medical students in your practices. So fellows take on 2 terms of, they tend to take on 2 terms of GP3 teaching, so year 3 medical students, which is the bread and butter kind of year where they're just learning to meet patients and examine them. So it's a nice course to be running. And then we also offer so Jeeves mentioned it as well, the great series of workshops. So we have six workshops, which are either face-to-face or online, where we explore different areas of the Associate Fellowship of the Higher Education Academy. So that's been talked about, and we encourage people to apply for that Associate Fellowship. So you get those letters AFHEA after your name. So we support all of that process, we try all sorts of new and different ways. So we do lots around online as well as face-to-face learning. They're very interactive sessions, and it's all around practitioner development. So it's literally what you're doing in practice. So people teach the students, they come back, they share what they've done. We try some different methods, we explore, give each other feedback. So we develop a community of practice, and we've been running this for, 3 or 4 years. And quite a few of our people have come through as clinical lecturers and actually worked more centrally in the team as a result of getting this experience. So we've got most of the stuff on the website. We've got the great program and the program themes, for example, which all align with the Associate Fellowship. Doesn't seem to be coming up, but I will make sure that it all works. But you can see the provisional dates and how it fits in there. So we use some various newer methods. We sort of explore some design-based methods. We're very interested in human factors and psychological safety. We bring in creative inquiry approaches in terms of how to support our students to flourish and grow. And actually the Queen Mary University of London, or Barts in the London, which is part of their highest mission, is that our students and staff will flourish. And so we're doing a lot of work around what that might look like. What would be the final thing? We didn't manage to have, I'll stop sharing there. We didn't manage to have any of our people with us today. We've got a few people on the programme. They also the workshops are combined with ST3 GP educators as well. So it's quite a nice sized workshop and good fun. And there are plenty of opportunities to get more involved in all of the central programme within community-based medical education. So that's provision of all of the placements across year 1 to year 5 in community-based medical education. And we also do a lot of work around co-creation with students. So we have an elective with year 5 students coming in and year 5 students teaching year 3 students. Basically, we're piloting and trying lots of new and different things. So it's always been very much appreciated and enjoyed. And I can put you in touch with people that are doing the programme if that's of interest. I hope that was 5 minutes.
That's perfect. Thank you, Louise. Much appreciated. I appreciate we're whizzing through some of these presentations, and people may have questions, which hopefully we can deal with at the end or subsequently. So please don't worry if there's things that are burning issues. We can deal with those as and when. I'm now going to hand over to Dr. Mohit Venkataram. Thank you very much.
Thank you, Sarah. Hi, everyone. Good afternoon. I'm Mohit. I am an Executive Director at East London Foundation Trust. Tammy, would we get the slides up, please? Brilliant. Thank you. So we've heard some great stuff today, but I was going to share very briefly in ELF what we are talking about. ELF stands for East London Foundation Trust. I qualified as a doctor about 33 years ago now. And if 33 years ago, someone had told me I was going to be managing 600 million, sitting on the board of one of the largest trusts in the country, managing the primary care division, line managing 2 medical directors and 6 service directors. I'd have probably run away as a doctor then. So I think the thing I want to share with you today is the offer at ELFT about creating a system where the opportunities for those of us who have just qualified and have aspirations both professionally, both in terms of leadership and personally. So how do you create that environment that allows you to have all those 3 met? Because as you go through your career journey, there are lots of different things you would like to taste, to feel, to have a dig at, and then perhaps decide what suits you as you reach a grand old age like mine. So I think I'll speak about what we are doing at ELFT and what the various opportunities are, and I'll be open to any questions people want to post in chat as I go through. Can I have the next slide, please? So, East London Foundation Trust is a large primary care, community and mental health trust. We provide services across 13 different boroughs, some in Northeast London, some in Bedfordshire, Luton. We have commissioning responsibilities in North Central London, approximately 11,000 staff, of which about 250 staff are primary care directorate staff. We have a list size of about 65,000 patients across a range of primary care services that we provide. Can I have the next slide, please? So you'll see some of the practices in East London that I mentioned, and these are really, really niche special practices. So inclusion practices in E1, that's in Tower Hamlets, and in Greenhouse, take care of people who are homeless, require specialist attention. So you'll have the opportunity to work in practices where the time allocated for each patient is anywhere between 25 to 30 minutes. The patients have opportunities to talk about their social needs. They have wider needs for financial needs, nutrition, health, and you work as part of an MDT in those areas. There is the Pathway team, which also works with acute trust, so Bath's Health, because evidence shows number of people who are homeless occupy 3 times the length of stay in inpatient when they're admitted. So the question is, how do you develop a process that's equitable and patients get the same care that they would if they were not homeless? And the Pathways team starts interacting and working with them. So the ability to have exposure both to acute care and to primary care starts with those kind of opportunities that are available within the primary care practices. The Newham Transitional Primary Care Practice, which has a list size of about 5,000 of the 65,000 I spoke about earlier, is a practice that takes care of both migrants, people who are transitional, so they move across borough to borough, have been moving around, and our delivery in these practices is amazing because the teams there have got a patient feedback survey result of over 80-85% engagement from our patients, something really astounding in today's environment from what we see in primary care. I think there's also the opportunity now in these practices to work with both the local hospitals and to have mixed sessions. Many people prefer now to have the portfolio career. I think I heard Venkatesh talk earlier about 2.5 days in practice and 2.5 days training. And I think that's becoming more and more the norm to get a flavor of a wide variety of opportunity as we grow the careers. So these practices offer you the opportunity to both work within the primary care core services or niche primary care services, while they also offer the opportunity to work with acute services and with community and mental health services. There are many GPs who work in our trust who have a portfolio career. So they started by getting a feel of community services. They then worked in mental health services and now have mixed sessions which they do a mixture of 3 and 4 between primary care and community, or primary care and mental health services, depending on their personal choices and experiences. Can I go to the next slide, please? Thank you. In addition to these specialist niche services that we provide, we also have the core primary care services. So Cordwell Medical Practice, list size of almost 10,000, Leighton Road Surgery, list size of 21,000, Kingsway and Birmingham Practice, which has a list size of about 18,000. So overall, they create the 65,000 list size I was talking of. What it gives you is the opportunity to have a range of different clinical fields, from core general practice to specialist general practices for inclusion health, and much wider ability to grow the portfolio into acute, community, and mental health services. So can I go to the next one? Thank you. Often I'm asked the question by people, will I have a BMA contract? Now, it's interesting when people raise this question, because having a BMA contract really is the bare minimum that you would expect in today's world. So I think I want to put it out up front. It's much more than the BMA contract. I'm quite happy to share a draft contract, what we offer, because when I joined the health services and I went on to become a consultant, there was never this expectation that I wouldn't be cared for well, so that I was free to focus on the clinical work. And that's the bare minimum that we expect of to be offering anyone. So everyone gets support. In fact, all the staff in wider primary care within ELF get Agenda for Change terms and conditions, which are the same terms and conditions that they would get if they were working in mental health, community health, or acute services. We also have dedicated medical education support, paid training and developmental opportunities. So the PAs we agree, the sessions we agree with the GPs also include a fixed commitment towards training and development, which is paid for both in terms of the course and the session. We do a lot of work on flexible working, and I mean, that's about life, isn't it? I mean, today I'm fortunate to have 2 kids over the age of 18, but I still remember when you're juggling your responsibilities at home and you really want to find a job that recognizes and values you both as a professional and as a person. And I think creating that flexible work pattern so that it works for people. You can drop kids in the morning, you can work flexibly, you can have a couple of sessions that you can do in a different setting altogether. Of course, we have the regular standard NHS support about annual ticket loans, tax-free childcare schemes that you will get benefits of. Cycle to work scheme, I'm far too old to enjoy this, but I know many of the colleagues I see now are very environmentally conscious, and I absolutely love it. I mean, I applaud my daughters who stand and talk about it and get upset with me when I jump in the car. So I think for those of you who are keen on it, that offer is there. Welcome back support from maternity and paternity, and the Tier 2 sponsorship. Since we are a large trust, we have a number of opportunities, and we have a number of people currently working with the trust on the Tier 2 sponsorship schemes. Now, in addition to all these, and you'll see the range of support mechanisms we have here, what are the wider offers we get working as part of a foundation trust like East London? Massive QI opportunities. If you are looking for getting involved, thank you, Temi, for getting involved in quality improvement and want to have some dedicated sessions, we'll have QI taster sessions, formal training sessions, and dedicated sessions within your work plan that allow you to lead on aspects of QI. Green agenda is a big thing. I mean, I recall when I qualified as a doctor, you were a professional leader. Today, as a medic, as a clinical leader, you are also a community leader. People look at you. They expect you to have a voice in what's right in society. How do you lead on equity, equality? So there's a lot of opportunities within the trust for equity, for equality, for leading on green agenda, for being a lead on LGBTQ and army veteran opportunities. So for those of you who are very socially conscious, would like to have some involvement with those areas, please do feel free to contact and have a view. We are one of the few partners with IHI internationally, and that's how our QI program was initiated about 10 years ago. So if you would like to be involved with the IHI program, we would be very happy to support and for you to then present your findings internationally across a range of countries where the conferences are held on an annual basis. For those of you who are very keen on research, we have two academic ties. We have a World Health Organization accredited Queen Mary Research Institute within the Trust, which does a lot of work on social psychiatry and social involvement. And we are also linked in with Cambridge University, where we are hosting the position of one of the professors within our trust, so that we could do some dedicated focused research on primary care. Clearly, I recall when I qualified first, and it's probably many of you think of this, the hardest question I had to ask was, I know I'm expected to deliver immediately as a specialist, but you do recognize I'm new and I need time to become grounded and feel comfortable without being fingers being pointed at me. So we have put in specialist dedicated pastoral support for all new GPs who have recently qualified. And we have two partners across the trust who are in their late 60s. They've been partners, they've been leaders in the local ICS and in the ICB PCT days. So they have dedicated sessions. So every fortnight they spend half an hour with each new GPs to just provide pastoral care. This is over and above the line management support that they would have from specialist GPs on their training component and their line management. Within the trust, we have a medical director for primary care who's a GP who has over 25 years experience of being a partner, and she reports to me in my role as the executive lead, and that's how we provide the overarching support. Sorry if I haven't gone over my time. Very happy to pick up any questions.
Thank you, Mohit. Not sure if we've got any questions yet. Possibly not. That was brilliant. Thanks very much for coming along and speaking to us about the opportunity. And finally, on our host provider list is going back to Dr. Tessin Khan to talk about opportunities regarding population health and health inequalities. Thank you, Tessin.
Thanks, Sarah. So hi again, everyone. So one of the roles that I started together with one of my colleagues, Dr. Payam Tarabi, around 3 months ago was as population health and health inequalities lead across North East London ICB. So really, I'm coming here with a half-baked idea, but I did want to get in there and actually talk to you all just to make you aware of some of our plans across North East London relating to health inequality and population health. And what we're sort of developing over the coming months and year, so that then when we communicate with you, you know the context of what is on offer. So we've scoped out the idea around creating a health equity academy across North East London, which will have 3 main purposes. The first one being that it will help upskill anyone that works in health or social care and help them actually get from strategy around health inequalities to actual operational, tangible ways of reducing inequalities in their patch, whether that's at surgery level, PCN level, or place level. So that's one of and we're developing a curriculum around that at the moment, looking at what's provided across the country and also how we can create a bespoke offer for North East London. The second part of the academy will be about sharing good ideas and good practice that other parts of North East London might have done, but actually can be applied across the patch in other areas. So, for example, what I'm doing in Springfield Park Primary Care Network might be applied to some areas of low immunisation uptake in New and Tower Hamlets. So I think that it's important to have that channel so that we can share good ideas. And the third thing is to help rationalise some of the data, the quality improvement, the analytics support we have across North East London, because there's a lot of providers, a lot of commissioners, and actually bringing that together so we can look at meaningful data that drives our action is really important. So that's all in progress. As part of this, we want to offer a fellowship programme. and we are scoping this at the moment. So we want to collaborate with the training hub and currently the offer that exists, and really build on that so that actually we can link up potential fellows with both places, so borough levels and also primary care network levels, where there's health equity projects happening, actually creating some sort of a link between ourselves as an ICB and those PCNs. And I know some of this work has already happened and is happening, but this is so that actually the offer is sustained across the entire patch, but also looking at what a curriculum, so what an actual offer might be for the fellows. So whether that's collaborating with QMUL, and it's great to have QMUL on call, where we can actually provide an accreditation process in health inequalities, for example, at the end of a year or 2 years of working with us. There's also a plan to sort of provide leadership training, peer support, etc. Again, I know that that's offered with the training hub, so we want to strengthen that offer. And there are certain, so as well as the place-based and the PCN-based priorities, there are North East London level priorities that we really want to focus on and are focusing on, and that's homelessness, refugees and asylum seekers, unregistered migrants being a priority. Very topical at the moment. There's a lot of political kind of upheaval at the moment around this community that is, really excluded from healthcare. And I think certainly being involved in the vaccination program, I came across people that hadn't accessed healthcare since they got here 20 years ago. So really important that we look at those populations. So I guess this is a call that if you are interested in any of the health equity project, I'm going to put my email address in the chat, so please get in touch. When we have more of a detail, and once as I said, we've only been in post for 3 months, so it's still quite early days, and some of this takes a bit of thrashing out. But once we have a more kind of solid offer, we'll come back to you, communications around that. And we're planning to officially launch the academy either autumn of this year or perhaps early next year in spring. But that doesn't mean that activities won't be happening before then, because I know some of you are obviously finishing training soon. So so we'll keep in touch, and it was just basically to make sure that I introduced myself and also kept you up to date about what we're planning, so that when you see an email from the Equity Academy, you know that it was that you first heard about it here. So thank you.
Thanks very much, Tassim. That's great. I think we've got a question actually from Aaron.
Hi. So this sounds very much like the kind of thing I'd be interested in doing. So it's a bit noisy here. I'm actually calling from the States. It's early morning here. Just a few quick questions. ICCT in August, in a couple of weeks. Would this be something, if it's a program that would be available to start in the next couple of months? I imagine, maybe not immediately in August, but certainly from September or something, because I am applying for other fellowships now. So I wouldn't want to, if I was doing something that started in February, it probably wouldn't be suitable for me, if you see where I'm coming from. The second thing is, would this be 1 or 2 sessions, and would it be 1 or 2 years?
Tassim, do you want to talk about
Sorry, I was struggling to come up. I think the best thing to do is, if I put my email address in the chat, let's take this offline and talk, because like I said, we are at an early stage, but actually, if there are people interested, I know we've got support from your teams there, so happy to have a chat and work out what your interest level, what your specific interests are, and how we can support in that. So I'll pop it in the email address now. Sorry, into the chat box.
Excellent, thank you.
Thank you. Mewish?
Hi, thank you for taking the question. It could be directed to Sarah, or wanted to ask. So PG cert is very complex. So for instance, if I get the SPIN program, maybe do a 1 year of leadership fellowship or diving, would I be eligible to apply for PG cert this year, or is just be within 12 months doing CC?
No, the PG cert is the exception, so that's within 5 years. So you could do a SPIN fellowship this year and apply next year, or indeed within the next 4 years.
Brilliant, thank you so much.
Sorry, that was an accident.
Okay, no problem. Thank you. Aaron, I'm not sure if you had your hand up from before, Aaron, or whether you've got another question for us.
Oh, sorry, I think I've got up from before. I'll figure out how I can
thank you.
Back down.
Okay, thank you. Laura Johnson, I'm not sure if you're on the call. If you are, Laura's one of our host providers at BARTS, providing the Breast Cancer Fellowship. If she's here, she might want to say a few words. Otherwise, we've actually concluded our speaker presentations for the afternoon.
Hi, I'm here.
Hello,
Sorry,
Laura.
I'm late.
No, not at all. Thank you. I didn't know if you wanted to say a few words about the fellowship opportunity that's in place with you guys at the moment.
Yeah, of course. Thank you so much. Hi, everyone. I'm Laura Johnson. I'm one of the breast surgeons at Barts. We currently have a spin fellow in the post who I believe has been settling in very nicely. She comes to us for 1 day a week and is principally at the moment doing one-stop clinics, so symptomatic patients, and then seeing them for their results as appropriate and discussing treatment planning. And then as she gets confident and settles in doing that, we've got some other opportunities for her, working with our high-risk patients and potentially exploring some genetics work and some family history work. So in essence, we're a trust, Barts Health. We have 3 main sites based here at St Bartholomew's, at Newham and at Whips. We have opportunities for GPs who would like to develop a special interest in breast surgery and breast disease. We're happy for you to be based at any of the sites. So if Newham's sort of more convenient for you, then we can set up a fellowship for you there. You'll be completely supervised by one of the consultants if you're on one of the other sites, but you'll ultimately be under my supervisorship. I think I'm very approachable, very amenable. I'm very happy to work with you to get what you need to fulfill your desires. Obviously, the job is for 2 years. Part funded through the college, and then the trust / Cancer Alliance provides the other PA. I think it's a really good opportunity. Certainly breast cancer at Barts is undergoing quite big strategic change. We're having a breast cancer centre built here on the St Bartholomew site, and the whole of the service is becoming networked. I think a lot of the work that we're doing as part of the transformation project is looking at the inequalities within our local communities across East London, trying to encourage engagement with screening, earlier presentation with disease. So we're really keen to get GPs involved, so this can be sort of a symbiotic and 2-way working relationship. You come to us, we help train you up, but actually you then go back into the community, help us with initiatives, give us ideas of what we can do to influence people locally and get the local population through the door to get them diagnosed earlier. So as I say, we've got one in at the moment. I think she's really embedded herself very nicely into the team, and we're very open and very flexible to work with potential GPs who want to get involved and explore what it is they'd like to do and help them achieve that through the breast service. Any questions? Great. Well, anyone that wants to reach out, I think you've got my email. Just drop me a line, and I'm very happy if people want to come and visit, meet us in person. That's fine. Thank you very much for your time.
Thank you, Laura. That's great. So that does now conclude all of our speaker presentations. Thank you very much for everybody that's made a contribution this afternoon. It's been really appreciated. I know time is precious and you've just given up 2 hours of your day. So we are very, very grateful to everyone who's spoken, fellows who've contributed, people that have raised questions, and indeed everyone that's participated. I am aware that people probably still have questions. There are things in the chat that we will deal with as a team subsequently and get back to you as soon as possible. And obviously we are all available on email, via phone. Please get in touch with any questions that you may have. We want to support you as much as we possibly can. This programme is all about recruitment and retention in North East London. Anything we can do to facilitate that, obviously that's our aim and our goal, and we can only do it with you on board. So happy to take a few more questions before we wrap up. We're due to finish in 6 minutes. But again, heartfelt thank you, and please approach us for any further information. Thank you very much.